Hello, good evening. How are you guys doing? How was your day? The fashionable midwife is here to say hello. How do you do? Hope you are fine. Woo. So I said, let me come and say hello to you guys and talk about care of perineal tear after childbirth. Care of perineal tear after childbirth. Yeah. Let's wait for some people to come. Okay, so care of the perineal tear after childbirth. When I say perineal tear, what does it mean? Do you know your perineum? Even as a husband, do you know what your wife's perineal area? Perineal area is from the VJ to the anus. The space in between is what we call the perineum in midwifery. So what is a perineal tear? A perineal tear is a cut or injury in the skin or muscle between the vagina and anus during childbirth. You know, there's what we call episiotomy, that especially for a first time woman giving birth, the our vagina may be very tight, and if the baby's head is big, sometimes we do give episiotomy to widen the space so that the baby can come out easily. But it's not in all women that we do that. If we see that we can, maneuver the baby to come out without tearing, we can do that. But if we see that if we don't give this episiotomy, the tear is going to be bad, then we can give episiotomy. Then later after delivery, we stitch it up. So that's a cut or injury in the skin or muscle between the vagina and anus during childbirth. And we have first degree, we have second degree, we have third degree, and we have the fourth degree. In talking about the first degree, is a minor tear on the skin. Second degree, tear into the muscle, and this is the most common ones. Hey, good evening, Trailer Zone 355. Good evening. Where are you watching from? Good evening. How was your day? So then we have the third degree. This extend to the anal sphincter. The tear, from that vagina to the anus. That's the third degree. Oh, okay. Good evening from India. Are you in the afternoon there or morning? I'm live streaming from Nigeria, Lagos, Nigeria. Thank you for the likes. I'm in Nigeria. Yeah. The fourth degree, it reaches the rectal mucosa. That one is the worst. It's a serious or something. Thank you. Thank you. So, but the truth about it is that, oh, Germany, okay, good evening. You are welcome to my live streaming. I'm talking about care of perineal tear after childbirth. I'm a midwife. So if you look at my wall, you will see that I talk mostly about pregnancy, newborn, antenatal, postnatal, and so many things that has to do with pregnancy and giving birth. Julie Batuli, good evening. How was your day? Hope you are enjoying Germany. How is the winter treating you? I know it's already very cold there now, and we are feeling so much heat in Lagos, Nigeria. Good evening. You are welcome to my live stream. So, but what I want to tell you is that most tears, they heal well with proper care. If you look at it very well, you take your drugs as prescribed and you do everything your midwife asks you to do, most time it will heal very fast without any complication. So why do tears happen? These are the reason why a woman can have tear. Oh, thank you. Thank you. Yes, even No, this year when I no last year I was in Canada. I went to church. So one woman saw this my spec and said, that she loves my spec. I was wondering, I bought it here in Nigeria. Thank you so much. I love beautiful specs. So and it's recommended. It's not for shakara. That's what I use in seeing very well. I can't read without glasses. So I love buying good ones. Thank you for the compliments. So what can cause tears during delivery? Large baby. If the baby is big, this is just a doll, but a baby's head can be as small as this. Some baby's head, very big, and if the vaginal orifice is small, this can lead to tear. And that's why sometimes we give episiotomy, because when we give episiotomy, it's a straight line medially that we give. Then after delivery, we stitch it up and we give the woman some medication and tell her on how to do sit bath so that it will heal in time. Then first second stage of labor, when I was doing the live streaming on TikTok, I said that there are some people, some women, as soon as they start they start feeling to push, they will just be in a hurry just to push this baby out, and let me just push this baby out because of the pain that they want to rest. No, it has its own disadvantages, so you have to follow it accordingly. This can also cause tear of the perineum. We call it quick pushing. Then operative delivery, especially where the doctor have to use forceps delivery or vacuum, this can lead to laceration in the perineal area. Then first time delivery, just like I told you, if it's a first pregnancy, it's possible for the woman to have tear. Then rigid perineum. There are some perineum that is just very rigid and tight. It can also cause it. Then shoulder dystocia, especially when the baby is trying to come out with shoulder, then or if one of the arms prolapse, it can also cause it. Then maternal exhaustion leading to poor pushing technique, when the woman is so tired during labor, maybe she has been laboring for a very long time and it is now time for her to push, but because she's so exhausted, this can also cause perineal tear. Then we have the immediate post-delivery care that me as a midwife or other midwives we do before discharging the woman. We have to immediately we see that the woman is bleeding. It's either you and midwife and the doctor, they will give her a thorough examination to see the extent of the tear. In fact, I was explaining that sometimes cervical tear may also be involved. So they need to be sure of where this bleeding is coming from and to grade the tear. Is it grade 1? Is it grade 2? Is it 3 or 4? That is when they will know. Correct grading of the tear is very important. Then we have proper suturing when it comes to. No, I'm a midwife. I'm a registered nurse midwife, though I'm not working for now, but I have so many years of experience. So I took this as my niche on all my social media handles to teach about these things, for women and their family to know more about this. So I am a midwife with experience. Thank you for asking. I'm not a gynecologist. Then pain relief medication also will help to relieve the woman of the pain she may be feeling. Antibiotic is needed to prevent infection. Ice packs in the first 24 hours, because most time we ask you to stay in the hospital for 24 hours before discharge, because we have to check you for any occurrence of bleeding. We have to check the place very well before you be discharged. We have to monitor for bleeding or infection. Then when the woman gets home, how to care for a perineal tear at home, she need to keep the place very clean. The area should be very clean, because if it's not clean, no matter the antibiotics you are giving, no matter what you are doing, the place can break down and can also be infected. Thank you. Then you have to use warm water to rinse after urinating. You don't have to use tissue paper. You have to use warm water, and you don't have to say you want to wash. You just splash it, because so that urine won't stay there, for the place to be very clean. Then sit bath 1 to 2 times in a day. Most time what we used to tell them in the hospital is that you should use a bowl, then put 2 cupful of your Dettol inside that water, warm water, not the water that will burn your body. Then you sit in it for like 30 minutes in the morning and the evening. for some days. This will also promote healing. Then you have to change your maternity pads every 3 to 4 hours. You don't have to put one pad from morning till night. That place will not heal because infection will set in. So you have to be very, as soon as you feel that the pad is wet, please change it and put a new one. And avoid using antiseptic soap. They slow healing. I'm not asking you, I only ask you to put Dettol, original one. I'm not saying you should use soap. Please don't use antiseptic soap, to wash the area, because this will slow the healing. Then how can you reduce pain and swelling as a woman that had perineal tear in the hospital? So you can use ice pack for the first 24 hours. That is if you are discharged after 24 hours from the hospital. If not, from the hospital, the midwife will advise you to use a ice pack to reduce swelling and pain. Then one compress after 2 days is now one compress will be used. But when it is just sutured, you can use ice pack to help in the inflammation and pains. Then after 2 days, you can use warm compress. Then you use your prescribed pain medication. Then you have us sitting on a hard surfaces. I said on the TikTok that you can get a pillow to put on your chair so that you sit on it so that you not feel much pain. Then support while using toilet. While using toilet, you have to lean forward when urinating, so that pressure will not be on that your perineum. You lean forward like this and urinate. Then pour warm water over the area to reduce stinging. Warm water, pour it so that you will not be feeling that stinging sensation. Then you have to make sure that you are not constipated, because that place is sutured. When you are straining, it can make that suture to give way. You have to take vegetables, you have to eat fiber rich foods, you have to drink enough water, you have to be well hydrated so that your stool will be very soft. Even in the morning when you wake up, you can take water, a cup of water, so that when you go to toilet, this will act as your stool softness, because you can't be straining with the stitches, it will give way. So those are the things that you will do. Then in promoting wound healing at home, you have to keep your legs slightly open for air to enter when you are in your room, not outside. You don't have to close your legs, so that at least air will enter there. Then wear cotton underwear, 100% cotton, because if you wear nylon, that also will make you, to sweat down there. So wear cotton underwear and avoid tight clothes. Avoid long period of standing or walking. If you walk a bit, sit and rest. So when are you to seek medical attention? When are you to seek medical attention? If you have perineal tear. Sorry jare, sometime my laptop used to mess up. So when you are to seek medical attention, if you have a perineal tear, when you have foul smelling discharge, you are feeling feverish, the swelling is worsening every day, instead of it to be relieving you, it's always, it's swelling more and more, you need to go to the hospital. Pain that is not improving every day, you are feeling tightening, so tight down there, and the pain is serious that you can't sit, you are not even getting yourself, you need to go to the hospital to see your doctor. Difficulty controlling stool or gas is an emergency, please go and see your doctor. Then severe bleeding, stitches opening or gaping, excuse me. Then sexual activity after tear. Explain the I have to tell you that you have to wait for like 6 to 8 weeks until your midwife says otherwise, because she will examine you anytime you go for checking. She will see, maybe you can resume that. If not, please listen to whatever your midwife tells you, and if it's time for you to do that, you can get lubrication, because it may be needed initially. The place may be dry, you'll be feeling pain, so you need to use lubrication. And you have to tell your partner, to use gentle position that is comfortable for you, that is convenient for you, that will not make you to strain or be feeling pains. Then you have to tell your partner to also go slowly. Then the most important thing in resuming sexual activity after your perineal tear heals is for you to be emotionally ready. That's the most important thing. You don't have to consider anybody, even your husband. But when you are emotionally ready, you are physically ready, you can have it. But don't say, I don't want my husband to cheat on me. I don't want this. I don't want that. Please take care of yourself. Yourself, you have to come number one. Then pelvic floor physiotherapy also can help. Then pelvic floor exercises, they are key. They strengthen the muscles of your pelvis, they improve healing, they reduce pain, prevent leakage, and you can watch some video on YouTube on Kegel's exercises for pelvic floor. This also help when your muscle floor is well toned up. This will also uh help you. Then how to prevent tears in future pregnancies. Perineal massage at 34 weeks is very important. Controlled pushing. This perineal massage, you can do it by yourself or you ask your partner to help you to do it. It helps as a preventive measure in case of next time. Then warm compress during crowning. That is the work of your midwife. She can put warm compress, and most time when I was working, we use olive oil. We strip it around the external hose. The place will be well oiled so that when the baby's head is coming, it will be very easy to come out without any problem. Then good back position also helps. Then avoid lying flat on your back when giving birth. Then midwife also will support the perineum during birth. Then staying hydrated and calm. You can see that most of these cases hydration is very important. You have to take a lot of water. Water is life, just the way they used to say. So those are the things I have for you, and I want to assure you that perineal tears are common, and with proper care women heal beautifully. Every mother's body is strong, capable, and designed for recovery, no matter what. Look, if we don't forget about the labor pains, nobody will go near a man. I'm telling you, if you remember the pain during labor, you will say, my husband, please stay on your own. I don't want to have anything to do with you. But God is faithful. You will, as soon as you set eyes on your baby like this, all those pains you will not remember again. So after 3 months again, you don't do the thing. So that is just the truth. God is a wonderful God. So perineal tears, they are common, and with proper care, they heal beautifully. So every woman's body is strong, capable, and designed for recovery. So no matter what you must have gone through during labor, your body will definitely heal. you know that's what we used to tell some men, that you have to show a lot of emotional support to your woman. A lot of women, it's not all the women that go into the labor room that come out alive. Some will come out with deformity. I've seen a woman that deliver up till now, she cannot walk. I've seen so many. Some of them, they have a ball, we call it a bell palsy. So many things. So pregnancy and labor is not a small thing. So please, if you have a pregnant woman, take care of her, and I'll see you some other time. If you have some question, you can drop it for me and I'll do that. Thank you for all of you. Thank you for the likes. Thank you for the comments. God bless you. Good night and bye.